p.m. The nights are getting darker. It's becoming a little bit more chillier. The flu season has approached, so I really do hope that you are going to be concentrating on your health and putting all of these aspects in gear before we reach the midst of the winter, because we all want you to stay happy and healthy. I hope you've all enjoyed your week, enjoyed your day. I know I certainly enjoyed my week in, well, various aspects, but it's been a stressful week, and this is always my time out. I love doing these shows. I love bringing to you what's the best, and we have a superb show today. I'm absolutely delighted to have my guest on the show, who I will be introducing to you. But I would love you to participate, so please don't forget to participate on this show by texting and WhatsApping us on 07745 278 978, or you can phone in on the studio telephone number on 01733 602 133. And you can look at us Facebook Live, because I've loaded up the Facebook page and I'm watching it to see sneakily if you are going to be posting any questions. And today I would like to welcome a wonderful guest to my show. I'm very privileged to have my guest because the consultants in Peterborough are quite a busy bunch. So I'm very, very privileged to have Dr. Vijit Puthi here on the show. Assalamu alaikum, Dr. Puthi.
Salaam.
Hello and welcome.
Thank you very
Peace
much
be
for
upon
inviting
you.
me.
Thank you. We are absolutely honoured to have you on the show.
It's a pleasure.
And I'm going to be telling you a little bit about Dr. Puthi. Dr. Puthi is a consultant paediatrician, a child specialist at the local Peterborough City Hospital, and he's been working at the hospital since 2006. He graduated from Osmania Medical College in Hyderabad in India, gained his basic paediatric training in London, and went on to gain specialist training in Liverpool. Dr. Puthi specialises in paediatric endocrinology, which is all to do with the system of hormones and diabetes. Now, Dr. Puthi does have interests outside his professional job, like most of us do. Mine is radio. Dr. Puthi is cycling, golf, supports a Peterborough-based charity called HEAL, which supports building orphanages in India. Now, what we were going to do is planning on speaking a little bit about height and growth in children, talking about fussy eaters again, because we see plenty of you little fussy eaters. So I hope you're listening to us on the show, the little ones of you who do listen and then come into the practice and say, oh, I see your show. I hope you are listening, because we're going to bring a few home truths to the show. And we're also going to be talking a little bit about diabetes in children, and also, sensitive topic, I say, about menstrual problems in young female children.
Yeah.
So, Dr. Puthi, how are you today?
Oh, thank you, Shabina. It's been a pleasure to be here. Thank you very much for inviting me. I'm doing very good. Thank you.
That's wonderful. And how is your day? Busy day? It's very busy in pediatrics at the hospital, isn't it?
I can't complain too much. It's fantastic working at Peterborough City Hospital and
Yes.
working with all my fantastic patients from Peterborough.
Oh, that's wonderful. And the fact of the matter is that we are very lucky to have you over here as well. Now, what I'd like to ask you, Dr. Puthi, is what actually inspired you to become a child specialist, a pediatrician?
Oh, I've always asked myself the same question. I think right from my medical school days, I've always enjoyed working with children.
Okay.
I always felt that children have this extremely capability of bouncing back to better health, and that gives a tremendous amount of job satisfaction. I have patients who I do blood test and yet they smile at me, and their smile makes a lot of difference to my profession. So it's all about job satisfaction, and the kids make my life much better.
That's wonderful perspective. You know, I never actually thought of that, because actually going through GP training, you do a pediatric placement as well. And as I was saying before the show, I'd be absolutely terrified when they call us for neonatal resuscitation when a baby's born, and just going there and thinking, my goodness, you've got a little sort of body in front of you who seems so fragile. And it would actually really terrify me. But I would always think that the smaller they get, the more complicated they are. But obviously that's not the case because you're doing it so well.
Oh, well.
So yes, it is, a very wonderful perspective you've given there. Actually, I will learn from that, the satisfaction of seeing a child smile when they get better.
And these little ones grow into a big monsters. And
Yes,
they're
that's
great
right.
fun to be when they grow
That's
up.
right. And being a mother of 4, I can tell you how big monsters they can grow into. So yes, I do share those sentiments with you, which is wonderful. Now, I think it would be pertinent to talk a little bit about fussy eating in children. And within primary care, I've seen that the increasing number of children actually do present to us where parents will bring a child. They've started weaning them and they'll sort of be pre-nursery age and say, doesn't eat fruit, we have problems with constipation, etc. How big is this problem actually becoming, Dr. Puthi?
Fussy eating is more of a perception issue of late. I mean, we used to have children from time immemorial, and so children are a reflection of the society.
Yeah.
So if you have a society that is becoming very much busier, they are becoming more addicted to TV screens, they are more addicted to iPhones and iPads, and nuclear families wherein children are only with their parents and not with their grandparents and the extended family. All these changes make a difference to how a child is at the dinner table.
Yes.
So you do have a sense that there is increasing amount of fussy eating, but if you look at the data or evidence, there's no such evidence that it is increasing in the frequency across the world. But there is clearly more parents complaining of fussy eaters. So we'll have to just introspect that question. Are children really becoming fussy, or are we perceiving them to be fussy because
Right.
of the other additional pressures that we have in our life? So that's something that we need to introspect.
Yes, that would be a good thing to actually look into, because when you analyze or compare the developed world with the developing world or the third world countries, for example, I can remember I was a fussy eater, and I've told this before to a lot of my listeners, and my mum even now says that she would sit there for hours and hours and I would keep just food in my mouth, and then eventually when my mouth was full I'd spit it all out. So that was the extreme of fussiness. She would actually show me pictures of children who were starving, for example, in third world culture in Ethiopia, and would say, look, you need to be grateful for everything that's been given to you. And do you think that this is part of the perception issue that you speak of, that sometimes a little bit of too much can be negative?
Yeah, I think that does definitely play a role. So you really need to understand the nature of fussy eating. If a child is really fussy and does not have any food, and the mother perceives that the child is losing weight or not growing, then it is a cause for concern. Then you definitely need to see your GP or be seen by the pediatrician. So there are clearly categories of fussy eating in which there are problems.
Right.
Most of the fussy eating children are generally toddlers
Okay.
and preschool children, where it is quite common for them. And the rationale for that is children grow quite extensively in the first 1 year of life. And in the second year of life, their growth begins to slow down. So they do not require so many calories as they did in the first year of life.
Yes.
So they don't want so much of food. So there is a natural shut-off mechanism in a child which says, I don't want any more. Now, there could be other reasons as well. And some children are called as fussy eaters when they are slow eaters, like the way you were. You probably were a very slow eater.
Yes, I was.
So they do eat very slowly, and there needs to be a tremendous amount of patience for them to go through with their meal. Some of the children get attracted onto the TV screens and don't want to eat, and we may just have to take that off.
Yes, that's
Some
right.
children might just get some high calorific snacks in between meal times, and that might have just stopped their hunger.
Yes.
So we need to understand as to why a child is being fussy.
Yes.
And my advice is never ever force feed them.
Okay.
Because if you did try to force feed them, it was actually very counterproductive. So children will never like to eat food, and they may have some issues with that. So my advice is don't force feed. If a child is fussy and you think is having a problem with his growth, then you need to see somebody.
Right. So the advice is from Dr. Puthi that generally it would start very early on in the initial stages of weaning, would you say?
Yes, I mean, again, in initial stages of weaning, it depends on if the child's got any medical problems. So if the child had a very common problem that children have is reflux, and they may have developed some problems with food aversion. Some children may be allergic to some food, and they do try to actively avoid it. So we need to know as to if there is a particular reason for avoiding certain types of food, or is the child being fussy all the time. If it is at the time of weaning a child becomes fussy and does not eat, I would prefer a doctor reviewing that child. A toddler doing that may be acceptable, but a child under the age of 1 being fussy needs to be reassured by a medical professional.
Yes, okay. Well, that's very, very interesting, because being a mum, I found myself going to a bit of panic mode when I see that my child's missed a meal. I think it affects parents more than it affects children. Would you agree?
It does, and naturally so. The baby is a part of your heart, and you will never want to let a baby go hungry.
That's right.
And mother's instincts are the most highly formed instincts in a human being, so you're more likely to feel that. However, if a child is saying no, you just have to look at the reasons of being no. Maybe he's just not hungry, or maybe he's just had something else to eat. So you just need to step back and assess if the child's being naughty, or it just doesn't want to have, it's just not hungry.
That's right. So it's about changing attitudes, not being so forceful with children as well.
Yeah.
Having said that, even if I go to my parents' house now, my father thinks I'm underweight and will say that I'm not being fed. But there you go. It's about changing of attitudes and perceptions, really, isn't it?
Yeah.
And in terms of a child that then comes to yourself, because we have now gone into the toddler stage, etc., the child's obviously failing to thrive. They're not really meeting centiles. What's your approach as a professional to such children? How do you work them up, just for the information of our listeners?
So if a child comes to the hospital and is referred for fussy eating, the first thing that we would do is weigh the child and take the length or the height of the child. And we plot them on some appropriate growth charts. Now, if the growth is suboptimal or it is not adequate for that child, then there is a concern. Now, in the same time they're in the clinic, we take an exhaustive history as to what the perception of fussy eating is. Why is the child fussy?
Right.
Is he being a slow eater, or is he had snacks in between meals? And we exactly ask the parents to maintain a food diary, which gives us an idea about how many calories they are having. Now, they also sometimes, if there is a growth failure, I ask them to be reviewed by dietitians as well, who do an exceptionally good job of counting calories and saying if the child had adequate calories or is in low in calories. Now, if there is a genuine concern that there is growth failure or the child's not putting on weight, and then I would recommend some blood tests to look for any underlying medical problems that might be contributing to fussy eating. And many a time we do find some underlying problems, and many a times we don't find any problems. It would be a question of reassuring the parents and keeping them under watch, making sure that the child's growing, and the parents then sort of come to terms that this is not a medical problem.
That's right. And obviously, being a clinician, a consultant, you would endorse a healthy diet to such parents, which I think is very important across the board. I think we all do encourage that. What do you have to say? Do you ever come across parents or patients who say, oh, but he doesn't eat fruit. Oh, but he doesn't eat greens.
Yes.
Oh, they don't eat that.
Yeah. It's a very common thing. It's a very common thing that we hear. I always talk to my parents and say, who is the boss here? Is the child the boss, or are you the boss? Who is in charge?
Yeah.
Now, if you let the child be in charge, then obviously they will not want to eat vegetable or fruit. It's not the most interesting thing to them.
Yes.
If you compare it to chocolates or crisps or other snacks. So it is very important to realize that the parent is the boss. And the parent, if they want to, can make the child eat healthy. Now, it's very well known that if children don't eat vegetables or fruit, they may need to be given at least 10 different times fruit and veg for them to register a taste for that vegetable or fruit.
That's very interesting.
So you just need to persevere. And in little children, when their interests are the prime reason for the mother, you need to know where to set the boundaries and say, well, you have to eat fruit and veg, and you have to eat healthy. So it's a matter of setting boundaries and making sure that parents are in charge and not the child.
That's right. That's a very, very useful piece of information, because that is personally something that I struggle with in my practice. And for those of you listeners who have just joined us, we have a wonderful show. It's with Dr. Vijit Puthi, who is one of the consultant pediatricians at the Peterborough City Hospital. We're very fortunate to have him today. Text and WhatsApp us on 07745278978, and I can see that some of you are watching us on Facebook Live, so get those questions in, or you can alternatively call us on 01733602133. And a message that Dr. Puthi has given you is that set some boundaries. Obviously, a healthy diet, which is what we do speak about week after week, is extremely important to give them exposure. And if you do feel that your child does not eat greens, does not eat fruit, as Dr. Puthi has said, you have to expose the child to that food type at least 10 different times before they develop a taste to it, which is a very, very interesting point, because that's not something that I would have thought of to give in the way of advice to my parents. So it's about an important diet, because keeping them deficient from various food types, fruits, vegetables, can lead to other things like constipation, which is a whole Pandora's box, isn't it? And I think we've got a caller coming in. So, yeah. So, we're just going to get the caller. Hello?
Hello.
Hello there. You're on Salaam Radio, and this is the Body, Health and Mind Show. Thank you very much for calling in. You are live. Who am I speaking to, please?
Assalamualaikum. You're speaking to Mohammed Saeed.
Hello there.
Hi there. I heard a friendly voice on the radio, and I was trying to put a name to the voice.
Okay.
Dr. Puthi was my daughter's doctor up until she was 16. So I just wanted to come on the radio and say hello to Doctor.
Oh, that's very nice. We'll let Dr. Puthi speak.
Walaikum assalam. How are you, Mr. Saeed?
Doctor, how are you? I'm not sure if you remember me. You have lots of patients. I'm Aksa Amina's dad.
Yes, I do remember. How is Aksa doing?
She's very well. She's studying to be a nursery teacher at the moment.
Oh, wow. She's grown, hasn't she?
She has, yeah. She's probably listening because I told her you were on the radio, so she's probably listening.
That's very nice. Give her my love, and
I will do. It's very nice to hear your voice again. So I just wanted to phone up. I haven't got any other questions. Just wanted to phone up
and
say thank you for everything you've done for us.
Thank you very much. It was a pleasure to take care of her.
And it's excellent to hear you again. Thank you. Okay, thank you, Dr. Shabina.
Oh, thank you very much, Brother Saeed, and keep on listening to Salaam Radio. Thank you very much for your call. Thank you.
You're welcome. Take care. Thank you.
Bye.
And that was Brother Saeed, who's called in to speak about the great work that Dr. Puthi has done. And obviously, he looks after his patients for a very long time because he's told us about the extensive history that he needs to take and how heartening it is, isn't it, when you listen to stories like that, which is wonderful.
It is. That was I was telling you about being a pediatrician.
That's right.
One of the great joys is to see them grow. And I remember that little girl, and I've taken care of her for the last 10 years. And for them to grow from those little children into those wonderful teenagers that they become, it is such a fantastic job. I would strongly.
Oh, that was, yes, definitely. Now you are making me rethink about what direction I need to be going. I've got my fingers in so many pies, but yes, peds, I'm changing. Well, that's so wonderful. And thank you very much, Brother Said, for calling in. What a wonderful phone call. And his daughter's becoming a nursery teacher. That's wonderful. So we'll give you a shout out to Brother Said's daughter. Thank you very much for listening to the show. And Dr. Puthi's given us some valuable advice about trying to set boundaries in fussy eating and how they monitor these children, and how you then go ahead and obviously speak to the dietitians. And I also think that the dietitians' letters are very helpful because of the direction that they give us. Usually it's a saving grace, because sometimes you are at a loss as to what to give children who aren't thriving and who look very little. And how do you get them to become optimum in the way of centiles? So we do get a lot of advice.
You do. One of the things that we would want the parents to do, or the children to do, is to try and increase the weight on as normal a food that they can have.
Sure.
Now, which would mean a mixture of Asian diet or a British diet. As long as they're getting in the calories, they should be fine. Now, despite all the trials of the doctor and the dietitian, if the weight still does not go up, then we are a bit concerned, because if a child is on lower weight for a long period of time, it can have an effect on their growth and on their strength of their bones.
Sure.
And so we got to look at not only now, but what problems this might bring them in the future. In about 10 years or 20 years from now, will their bones become weak? So in that case, so despite all the efforts, if they've not put on weight, then we would possibly encourage them to have some high calorific drinks.
Right.
But that doesn't come immediately. It comes after many steps of seeing the doctors and trying to increase the calories and so on. So I would not recommend anybody going on high calorific drinks without a proper medical review by a doctor or by a dietitian.
Sure.
These are the people who know about these high calorific drinks and prescribe only when it is necessary.
Right. That's wonderful advice, Dr. Puthi. What are your opinions about giving vitamin supplements to children, vitamin drops, for example?
Now, in Peterborough, where there is a significant amount of number of Southeast Asians and of various cultures, we had done a study here, and we found that about 80 to 90% of all of us are vitamin D deficient.
Sure.
That's because of the color of our skin and the lack of sunlight in the country. So we tend to become vitamin D deficient. And vitamin D is very important for a number of factors, but in children especially for bone strength and for growth and for their general immunity.
Sure.
So my recommendations, and there are national recommendations as well, is for children to have multivitamin supplements,
Right.
especially Asian and Afro-Caribbean children, and in the early days with breastfed mothers, because they don't get adequate vitamin D.
Right.
You have to be very cautious with vitamin supplementation. Do not take willy-nilly vitamin supplementations, because they can produce hypervitaminosis.
Right.
You have to be very careful with excessive vitamins intake, especially of vitamin A and vitamin D, which can have some serious consequences.
Right.
So it is a good idea to take some vitamin D at normal doses as a multivitamin children tablets. But if a child has got bone pains or aches and the child seems like having vitamin D deficiency, then it would be a doctor that would have to prescribe a high dose of vitamin D for a short period of time and monitor them.
Sure. Well, I think that that's all very useful advice, because a lot of the notion is that mothers automatically say that, okay, yep, this child isn't, they're fussy eating. And I'll often get mothers come to me and say, can you prescribe us some vitamins? But that's actually not always the case. I'm really glad that we have addressed this, because it is something that needs to be put out there in the way of messages. So we've had some really important messages go through to you listeners in terms of obviously fussy eating, in terms of vitamin supplements, in terms of dietary recommendations. And like Dr. Puthi says, always make sure that you try to conform to a normal diet, rather than thinking that the more fatty foods you give, the greater or the more quickly they will thrive. We are coming up to a break. It's absolutely wonderful having Dr. Puthi's company here on the show. This is Salaam Radio. Don't go away. Come and join us after the break.
Stay tuned to Salaam Radio after this short ad break.
Sadly, millions of orphans living in the poorest countries lack the necessary support for a healthy childhood. These children have to endure lives of hardship without the basic necessities that will help them to grow, to learn, to live. Let's show them that we do care. Let's brighten up their future. Call 0161 225 0225 or visit humanappeal.org.uk.
City Homes Estate Agents are your #1 independent family-owned agency in Peterborough. We offer a range of services including buying, selling, letting, mortgages and conveyancing. Why not call us today and find out for yourself why our customers return time and time again. We have a track record for achieving some of the highest prices in and around the area for our clients. With over 10 years of operating in the area, we are the experts in this market. Put us to the test today by calling 01733 348 677 and quote discount code RADIO for our exclusive rates for this promotion. City Homes, bringing people together for over 10 years.
Third world and developing countries are home to some of the most vulnerable children on the planet. Malnutrition, severe lack of medical aid and access to clean water are just some of the horrific challenges faced by orphans across Africa and Asia. Children of Adam, a Peterborough charity, need your help to bring aid to these orphans for just £25 a month. To sponsor an orphan or assist with other projects, please call 0300 321 0032 or visit www.childrenofadam.net.
Maha Zain is coming to Leicester with a debut tour of his latest album, One. See him perform at the Athena on Saturday the 21st of October. This inspirational tour is brought to you by Penny Appeal and Awakening Records in aid of girls' education. Buy your tickets now. Visit pennyappeal.org or call 03000 11 11 11.
Do you have lots of clutter at home or in the office that needs to be kept but nowhere to keep it? Ivet Self-Storage offers a secure, affordable, clean and dry home for your belongings. We have security systems in place which are monitored 24 hours a day, ensuring that your items are safe. With a simple monthly payment, Ivet Self-Storage provides secure and tailored facilities to meet your specific requirements, whether short or long term. We offer the best prices and longest opening hours in Peterborough. For more information, please call on 01733 306 456 or visit us at Ivet Way, Westwood.
Do you like the idea of being a radio presenter? Have you got a great idea for a show? Why not get in touch with us? We are always looking for enthusiastic, committed and professional individuals to join our team of volunteer presenters. Send us an email to info@salamradio.co.uk and we'll be in touch. You could be on air sooner than you think.
Assalamu alaikum wa bismillah. قال رسول الله صلى الله عليه وسلم كن في الدنيا كأنك غريب أو عابر السبيل. That be in this world as if you were a stranger or a traveller.
This is Salaam Radio, Peterborough's Muslim community radio. Broadcasting on 106.2 FM and online.
Assalamu alaikum, peace be upon you. Welcome back, everybody. This is your very own Body Health and Mind Show with your very own Dr. Shabina. I do say I'm your very own Dr. Shabina because I get stopped in the supermarkets. I get stopped by little children saying to me that, oh, you're the doctor who does the radio show. Yes, I am indeed. And it's wonderful to have all of your company. I indeed do enjoy this very much. And thank you very much for coming back and staying with us on this absolutely wonderful show, which I'm so excited about because we have such a wonderful guest with us. We've got Dr. Puthi from Peterborough City Hospital. Thank you for staying with us.
Thank you very much. It's so far so good.
So far so good, and we're enjoying it, aren't we?
We seem to be.
And we're getting a lot of good response, obviously, which is wonderful. Now, Dr. Puthi, we've been speaking about fussy eating, etc. And I wanted to speak sort of a little bit on sort of diabetes.
Yeah.
Sometimes I've seen in primary care, you will see a child who's lethargic, having weight loss, which aren't very typical symptoms of diabetes that we usually see in adults, which are urinating frequently, feeling a lot more hungry. Sometimes they have a bit of loss of weight and feeling very thirsty. But could you tell us a little bit about childhood diabetes, please, and what are the signs, symptoms to look out for to our listeners?
Right. A lot of your listeners need to understand that the diabetes in adults is a completely different disorder compared to the diabetes in children. In adults, it's mostly because their bodies are not sensitive to insulin in their body, whereas in children, their pancreas get damaged and the children do not form any insulin. So they are very different to each other.
Yes.
Now, in children, they can present usually, the earliest sign is if a child has always been quite good at not wetting bed, and the first symptom would be wetting their bed all of a sudden.
I see.
If it is one occasional, odd occasion, there's not much to worry. But if they have started to wet their bed after having gained control of their bladder, that's a warning sign. Now, few weeks or months later, they might start to drink excessively.
Right.
And again, go to the toilet excessively, weeing excessively. They might be very hungry, but they might lose weight.
Right.
And one of the very non-specific symptoms that they might come is tiredness, an inability to concentrate at school. But it's just not the inability to concentrate at school. It needs to be all of these symptoms, more of these symptoms together that can make the diagnosis of diabetes. Now, if any of your patients had these symptoms, they would usually see a GP and get their blood tested or the urine tested for high levels of sugar.
Sure.
If the GP diagnoses diabetes, they'll immediately send them to the pediatric diabetes team at the local hospital.
Okay.
So, in a nutshell, if a child's very tired, in addition to drinking too much or weeing excessively or weight loss, you need to be worried about diabetes.
Right, I see. And when you say blood test, we're talking about a finger prick test, or would you say for GP purposes? Because there are quite a number of sugar tests. So I get patients asking me, is this a fasting blood test? Is it a random test? Or is it a HbA1c for children?
Oh, it's a very interesting one. Usually in children with diabetes, young children with diabetes, if you do a blood sugar at any time of the day, this is at presentation, they will have high blood sugars.
Sure.
If you do not have high blood sugars, it's unlikely to be diabetes.
Right.
The fasting sugar business is mostly done in adults, where adults gain excessive weight, and that might initially cause them to have fasting hyperglycemia, which means that the blood sugar tends to rise on fasting. So it usually should come down, but if it is still high on fasting, that may be an early indication of diabetes in slightly older patients, but not in pediatrics. They usually will have high blood sugars anytime if they were to have diabetes.
Okay. And where do you pick these children up as a clinician, Dr. Puthi? What's your involvement with such
Usually once the GP sends them across, so that's when the whole team gets involved. We got 2 consultants who deal with diabetes in children at Peterborough. There's a team of fantastic diabetic nurse specialists, a dietitian, a psychologist. We all deal with the patients with diabetes in the hospital.
Right.
And now this all has to be dealt in hospital, because if there was a diagnosis of diabetes, they go through a program of education. It's a big shock to any family to have a little child having diabetes. It's a big shock to their system. And here comes a doctor and says, or a nurse comes and says, you got to give 4 injections a day, blood testing a day. It's too much to take in.
It is.
So we gently prepare them through a program of diabetes education. We talk to them about the injections. We talk to them about the blood testing, how to do it. We talk to them about the diet, and slowly prepare them, slowly try to adjust their life to deal with injections. So it all has to be done in the hospital, unfortunately.
Yeah.
This is only for children with diabetes, and then they are followed up in a clinic very regularly at Peterborough City Hospital.
Right. But it just does demonstrate the very multidisciplinary approach you have to these children, which is wonderful, really, because one of the things that a lot of people don't appreciate is something known as empathy, which is putting yourself in the patient's shoes and actually appreciating that this patient or family really, when it comes to a small child, are going through a process that is, number one, come as a bulldozer type shock to them. And the one thing that little children are very afraid of are needles. So having to put that in very slowly can be difficult.
It is very true. As a diabetes team, we sometimes tend to wear the pump ourselves.
Wow.
Just to have a feel of what it means to be a diabetic. If you wear a pump, you're putting in a cannula into you, doing blood tests every day, 4 times a day, a doctor needs to have an idea of what it means to be in the patient's shoes or in the parent's shoes. So we try to do that once in a while, and it is very difficult, and it tells us what kind of lives the diabetic patients can have, and it makes you more empathetic towards the cause. So yes, it is a difficult one, but our patients are brilliant. I mean, they come and within a month or 2 they get so good at managing their diabetes that they come and tell me, no, Dr. Puthi, this is the way we should do it. So it's good fun. It's great fun. They're fantastic. The problem with diabetes is when I joined Peterborough, there were just only 110 patients with diabetes. Now we almost have 250. So there is an increasing frequency of diabetes in children. So I think your listeners need to be aware of the warning signs.
That's right. And I think you've put the signs and symptoms out very well to parents or to some of you that are listening. And if you've just joined us, we are on the Body Health and Mind Show with Dr. Shabina and Dr. Puthi, the consultant paediatrician at our very own Peterborough City Hospital. So do text and WhatsApp us on 07745278978 or the studio telephone number, which is Peterborough 01733 602 133. And we've spoken about the signs and symptoms of diabetes, Dr. Puthi. But for those people who actually have children who are diabetic, what are the serious complications and signs to look out for in a child who could be deteriorating?
We always, all our patients get reviewed on 3-monthly basis, and we have a telephone, out of hours telephone. Our patients can use it anytime, 24/7. It's a part of the service that we provide, an out of hours service. And our patients, if they had any problem, they do call us up and we immediately address. And not only the consultants, it's the nurses who do the major part of the work and address these issues. But what we want and what we talk about in our clinic appointments are the necessity to keep diabetes under control. Because you see, little children don't know about what's going to happen in 10-20 years, and teenagers don't tend to be too worried about it because they live in the present.
That's right.
So we just gently try to put across that diabetes control, a good diabetes control, is important, because if it is not, then we might have problems with eye complications or kidney complications. And this tends to go into a conversation in a very gentle manner. We're not trying to scaremonger people. That's not the aim.
That's right.
The aim is for children to understand the importance of a good diabetes control.
That's right. And I think I do completely agree with you that sometimes putting forward a realistic outcome of what could be if health isn't looked after is something that we do as clinicians as part of our responsibility, so that patients take responsibility as well, because it's a very sort of common line that I use with patients. There's some things that we can do to help you, and there are some things that you can do to help yourself. And indeed, part of your multidisciplinary approach towards patients who have diabetes also entails that they are taking that responsibility seriously and instilling the education that you have given to them, which makes the continuity of care flow.
Yes, it does. This word responsibility is slightly tricky.
Sure.
The thing that I need to get, yes, it is very important for patients to become more independent as they are becoming somewhere in the mid-teenagers or late teenagers. But it also requires parental supervision.
Sure.
So it's a bit of a delicate balance, like that we try to get when we are trying to let the child go free but still holding on to them.
Absolutely,
so it needs to be that delicate balance of giving them the independence but also keeping a watchful eye on them.
That's true.
Because children of these days can have various many things attracting them to different directions.
That's absolutely right. Yeah, so that is another message that Dr. Puthi is giving to you, my listeners, that if you have obviously children who have been diagnosed with diabetes type 1 after going through this wonderful multidisciplinary approach that Dr. Puthi has described at the department and at the hospital, wonderful Peterborough City Hospital, they become independent quite quickly.
Yes.
Because they're injecting themselves, which is a big thing. I still have a phobia of needles. So for them to embark upon a treatment like that is very big.
I think all my diabetic patients are true heroes, truly positive children, and truly remarkable children. All my diabetic patients are just exceptionally brilliant.
How wonderful.
It's so brave.
How wonderful to hear that. So it's about keeping a watchful eye as well on such patients. Now, I'm coming to something sensitive. I always like to talk about more challenging topics because it pertains to the community and often unspoken about. We are a Muslim radio station. A large part of our Muslim population comprises of South Asian members of the community. And often it is female problems that aren't really spoken of in a confident and in a very open manner. So this is where I like to open the floor and speak about it without any apprehension whatsoever, being a woman myself and speaking to somebody of great expertise. And you also treat problems where young female children will present to you with period or menstrual problems.
Yes.
Could you tell us a little bit about that, please?
So as a hormonal specialist, one of my roles is to check on children who might have problems with early onset of puberty.
Sure.
By which I mean if a girl starts to develop breasts under the age of 8, or the boy tends to show signs of development under the age of 9, they need to be seen by a doctor immediately. Similarly so, if there is any delay in puberty as well, that is a specialist intervention required, because delay in puberty can again weaken bones.
Sure.
So these are a few things that I deal with on a routine basis: delayed puberty or early puberty. Now, your listeners may want to know that the Southeast Asian or South Asians as well as Afro-Caribbean girls are going into puberty much earlier than their Anglo-Saxon white counterparts. While worldwide, the age at which girls are starting puberty in Asians and in Afro-Caribbeans is coming down.
Yeah.
Now, one of the speculated thoughts is that these children are becoming, the weight is being put on and therefore is causing early puberty.
Sure.
So we need to be wary of that. But your listeners need to know that if a girl goes into puberty, by which I mean early stages of puberty under the age of 8, or a boy under the age of 9, they should seek medical help.
Okay. And when we say delayed puberty, because often there is a age boundary, isn't there?
Yes.
I've often seen this when I've tried to refer patients. Is it the cutoff 15 years and 4 months?
Actually a little bit lesser than that.
Okay.
We talk about 14. 14.
Right.
Now, again, there are consequences of this. If a boy or a girl, if a girl doesn't have periods by the age of 14, then that is late.
Okay.
If a boy has not started puberty by the age of 14, then that's definitely late.
Right.
Again, they need to be reviewed by endocrinologist or by GP to look for any underlying issues that may be causing either early or late puberty.
Okay. If a female presents to you with, say, we call it primary amenorrhea in medical language, basically means non-starting of periods for the public or the listeners. What can be the causes of that? Obviously, we have ovarian failure, don't we?
Right. The commonest cause would be if the mother has gone into puberty late. So the girls generally tend to follow their mothers in the timing of their puberty. So there may be a very simple issue like what we call as a constitutional delay of growth in puberty, or in layman's term, late bloomers.
Sure.
It may be just that, but that needs to be assessed by a doctor and made that diagnosis. But the other causes are if there is an underlying medical problem which causes them not to start puberty, that needs to be assessed too. One of the increasing number of patients who are coming these days is unfortunately an ovarian failure, which you were mentioning about. Now again, in this group, there is an ovarian damage because of chemicals called as antibodies in the body. And it is increasing, nevertheless very rare in children, but nevertheless increasing in frequency. So, if a girl does not have periods by the age of 14, definitely, or even earlier, I would say, if a girl does not start puberty by the age of 13 to 14, I would seek medical advice.
Right,
Yeah.
okay. That's very important, that is, because we do often see patients who haven't started their periods. They will have secondary characteristics. When I say secondary characteristics, listeners, it's about development of breast buds, development of hair in the pubic areas, etc., which sort of are a sign that, yes, they are about to embark upon a period, possibly. But the other causes could be due to thyroid problems as well?
Yes, one of the common things is that if the periods do not start or have started and stopped, then you really need to look at the weight. Weight is extremely crucial for a girl or a woman, and the body weight is one of the markers for a regularity of a period. So if girls lose weight too fast, if there is acute weight loss, or if they've gained weight all of a sudden, it will have an impact on their menstrual periods.
Yes. Okay.
So that is something that we need to look for.
And in addition to that as well, Dr. Puthi, can I ask you, you're talking to us about ovarian failure. Are there any studies or any research do you know of that has been done to establish the cause as to why antibodies? Is there any are there any conditions that one could be suffering from?
It's usually what we call as an premature ovarian failure. Most of them tend to be idiopathic, by which I mean a known cause is not found. But we time to time find chemicals in the patient's bodies called as antibodies, which can damage patient's ovaries. So we need to look at that. But there are many other medical causes that can cause the ovaries to fail.
Right.
And it is a very specialist area. So if anybody has got problems with not having periods or periods stopping for a significant time, then they need to be properly assessed.
Okay. Are they sent to a specialist centre, for example?
Yes.
Or?
I mean, we do work them up in Peterborough. We have a very good team of pediatric gynecologists as well. We work together and we do treat them. And when I treat them for premature ovarian failure, and when they're getting to that age when girls become a little bit shy to talk to a male doctor, I sort of talk about transferring their care to a female doctor, either at Peterborough or at Cambridge, where some of my pediatric colleagues do take a good care.
Yes, and I think it's, again, very much a multidisciplinary approach, because there's some people might not know that if a patient is diagnosed with primary ovarian failure, and for the age of our listeners and their understanding, that means that they will never be able to have children.
It is something that needs to be dealt in a very sympathetic and empathetic manner. It needs a lot of gentle discussion with the parents, and if it is appropriate with the child. So it needs a very proper discussion.
Yeah. I do think that coming from a member of the Muslim community, South Asian community, the fear of having something like that and its future implications must be quite dramatic and quite, burdensome.
It is definitely a cause for concern for mothers, especially with mothers, and having to know that their children may not have future pregnancies is very hard to take for any mother. So we do gently try to address that. I always take the help of a psychologist if I can to talk to them, because it does have quite remarkable implications later, and the girls at that age may not understand the gravity of the situation.
That's right.
They may not understand the whole business, and in fact some of the girls tell me that we don't want to have periods at all.
Yes.
So some of the girls may be actually happy, but the long-term implications are much beyond the imagination of a child at that age.
That's absolutely right. A very valid point, and I think something that's been resonating throughout the show is approaching a patient with empathy. Everything that we've spoken about, Dr. Puthi, is really about managing the family as a whole, especially in your area.
Yeah, my job is not done. My job is completely not done if I do not take care of my parents. They are the one who I need to convince in addition to the child. So I cannot have a parent who's dissatisfied because that's job not well done. So it is very important to take that into consideration.
Yeah, and it's very heartening, I think, to see that you deal with a very wide range and a wide plethora of conditions as well. And for that, I'd really like to thank you for coming on to our show today. It's been such a pleasure to have you on and to make the community and the listeners at large, because we actually have some international listeners as well as all over the United Kingdom who listen to the show, so they would have gained a lot in the way of knowledge and gaining from your expertise. So thank you very much for coming and joining us today.
Thank you, Shabina, and thank you, Salaam Radio, and thank you to all your listeners and to the Muslim community of Peterborough for inviting me. Thank you.
We're indeed very grateful, and hopefully in the future as well, we would like to hear you talk about some various other things to do with your area of speciality.
I would love to come back. Thank you.
Thank you. So that was Dr. Vijit Puthi, who took out his valuable time from his busy schedule to join us, my dear listeners. And like I say, we were saying in the break that it's come to an end, the show. It always comes to an end too fast. It really does. And every single time I look at the clock, I think, oh, but listen, listeners, I wanted to tell you about something. On the 8th of October, on Sunday, it's going to be the 5K fun run. The presenters of Salaam Radio will be running 5 kilometers. I know it doesn't sound like too much, but trust me, it's a lot for someone like myself because I'm going to be part of it. So if you could click on the Salaam Radio page. For goodness sake, like the Salaam Radio page. Show your support us. Come and sponsor us if you can, even if it's for £1. I don't mind getting £1 for my humble sort of efforts. And if I come out of this alive, I will be back here next Wednesday to tell you with my aching joints how I did, because I've never done 5K in a row and it has been extremely difficult in my busy schedule because I haven't managed to practice for it either. But yeah, please do give us your support, and I can't wait to see you again next week for another Body, Health and Mind show on your very own Salaam Radio. Assalamu alaikum.